Hello, it's Monday, the 21st of May 2018. Hello, everyone. Thanks for joining us. I'm Russ McLean, Chair of the Patient Voices Group, and today I'm in conversation with East Lancashire Hospitals Trust Chief Executive, Mr. Kevin McGee. Hello, Kevin.
Hello, Russ. Nice to see you again.
And you too. And nice to have this hot weather as well. Kevin, last month we touched briefly upon the use of artificial intelligence, or AI, and how it might play a part in the near future in the NHS. Now, our conversation last month was quite timely, given the news, the rather sad news, a few days later, about a computer error which was responsible for hundreds of thousands of patients not being invited back for breast screening. So I had a couple of questions in. With an ever-increasing reliance upon computers, isn't the NHS setting itself up to fail at the cost of patients?
So we always have to be vigilant, but if you look at some of the errors that have occurred in the history of the NHS, a lot of them are human errors where we use paper systems. And if you think about, we have hundreds of thousands of patients' interactions every year. To think that we can keep control of that just by use of paper when we can use better computer systems, I think we have to look at that and we have to move in that direction. So I take a view that if you look to the future, be it artificial intelligence, be it digital technology, be it automation, it's going to have a fundamental impact on the way health services are delivered. And what we've got to do is to make sure it improves health services so it frees up people's time so they can do more of the caring roles. And if you like, the administration, the paperwork, all the scheduling, all the back stuff can all be done to free people up to do the hands-on caring.
And I was looking at some of the figures, of course, and computers obviously can handle huge amounts of data very quickly. So presumably this is going to save lives in the future because they can analyse data very quickly.
Oh, I think that's absolutely the case. That without getting too technical, that there's something that we call population health management, and that uses sort of big data to really try and understand what's going on in our population and how can we use our resources to really improve people's health by targeting resources in a different way. Now, it would take a whole army of individuals scribing and understanding the data to do the same stuff that a computer would be able to do very, very quickly and analyse the data. So we have to move in that way. It would be daft not to. But what we have to do is build in safeguards, as you say, so that we don't get issues such as what's happened with the breast screening over the last few weeks.
Patients written into me to say what kind of tasks do computers already do at ELHT. And you've already explained what types of jobs they might do in the future. But of course, thinking of computers, we've already got this fantastic robot here at ELHT. This is the urology robot.
Yeah, so we have a robot that is undertakes surgical activities in not just in urology, but primarily in urology. Now, clearly that is controlled by very, very skilled, very specialist consultants. But what it allows us to do is to do very intricate surgery, and allows therefore the recovery rates to be much, much quicker and the outcomes to be much better. So we already use really sophisticated technology to undertake surgery, and what we're trying to do within East Lancashire is to get the best of the most up-to-date technology that can do the best, the most fanciest things possible, but to always remember that the root of any health service is a caring profession and making sure that we treat people with respect and dignity and look after their needs.
We have already heard in the news about antibiotics and resistant strains of infections, but now scientists are also warning us of a resistance to treatments for fungal infections, and this is presumably going to put patients at more risk, particularly those in intensive care, transplant patients and those with cancer. Because, of course, their immune systems can't fight infections. Is the Trust, or how is the Trust, dealing with resistant viruses, bacteria and fungi? And is the Trust taking part in any research at the moment?
So as you solve one problem in health, another one arises, and this is a great example, or a good example. And clearly we have to follow the best practice that possibly is in terms of hygiene, in terms of use of antibiotics, in terms of use of medicines, and we do so. But we're also a major research centre. So East Lancashire, last year alone, we took part in over 90 clinical research studies, which was 1,400 patients involved. And it's really important that we do, because the research and the evidence that comes out of those clinical trials really sets up health and healthcare for the next generation and for the future. So, we work in conjunction with other trusts. We work very closely with the clinical research networks in Manchester, in Liverpool, in Preston, and we all support one another with these trials and trying to get the best evidence to get the best practice for future care.
Now, in your last blog, you mentioned a forthcoming CQC inspection. I've personally noticed the change in the board and staff attitude to CQC inspections over the last few years. In the past, these inspections might perhaps have caused great unrest at the trust, but now all staff seem engaged with the process. Are there particular areas on which the CQC will focus during their next inspection? And how important, Kevin, is it for staff and for patients to actually share their experience with inspectors?
So I'm quite excited about the CQC visit. It was a great chance and a great opportunity for us to show what's going well in the organisation, to celebrate everything that's good, but also to learn if we need to improve in any particular areas. It's a new style of inspection, so we actually don't know when they're going to be coming in yet, and we don't know exactly which areas they will review. So it's very, very independent. And they will come in and they will review a number of core services. And that will be followed in the autumn by a further review, which is what they call a well-led review, and it will look at how the organisation is led from the board right the way through the organisation. I would say at the outset now, I would encourage staff, I would encourage patients and communities to get involved in the CQC review, because one, it's important that people have their say. It's important that the things that we do good are recognised, and it's also important that that if we need to improve any areas, we pick up on them also. And if you think about the last CQC visit, we were rated as good, and that was a tremendous fill-up for the organisation. It really improved patient morale. It was a great lift for the organisation and has really put us on a terrific footing for attracting additional staff, the best and the brightest staff, for attracting additional resources. And, I think it's a consequence of that CQC good rating that we're in such a good place now. So I'm not complacent. I'm really, really excited about the review. I would hope that it picks up that we've really made improvements since the last inspection, but I would encourage staff and patients to get involved.
I'd like to pick up on something that you just mentioned there, and that was about staff, the prospective staff even, looking at those ratings perhaps across hospitals across the country and using that to decide where they're going to work. That sounds very, very interesting.
No, we know that absolutely takes place. So if you think about the NHS workforce at this moment in time, there are a number of areas, be it doctors, nurses and other areas where there's a real national shortage, and some of these staff can go anywhere. So, they're looking at an organisation, they'll look at its CQC rating, they'll look at its reputation, they'll look at the staff satisfaction service before they make a choice of where they want to come. And clearly the fact that, we've got a good staff satisfaction survey, we've got a good CQC rating, really shows that, it's a good organisation, it's going in the right direction, and it attracts the best and the brightest staff to come and work and support the services and support clinical care delivered to the communities in Pennine, Lancashire.
It's been remarked upon on a couple of occasions to me that you talk about Ramadan and fasting in your weekly blog, and indeed in a few days' time all staff will have the opportunity to take part in a one-day fast. But I've had a question in from a member of the public who wants to know, have you personally ever fasted, and why is it important to you as Chief Exec that you support all your staff, no matter what their faith?
So we have a population that's very diverse, and it's important that the workforce represents that. So we have a very diverse workforce also. And in terms of my role as Chief Exec, I absolutely respect the different faiths, the different cultures, and really want to support people to feel comfortable working within East Lancashire, to feel comfortable delivering services to our communities. So it's really important to me that we represent and we respect people of all faiths and all cultures. And so Ramadan, clearly a very important period, and it's important that we respect that and we support our Muslim colleagues who are fasting at this particular point in time and do everything that we can to support and help them. So I wanted to mention it in the blog. I wanted to recognise it in the blog so that we can provide that support the best that we possibly can.
So have you ever tried fasting?
I have over various periods for various reasons. I can't say I've done it with a great deal of success, if I'm being honest. But I think it is something that it's this thing, isn't it, about walking in somebody's shoes. Before you can understand somebody, for a period of time you need to walk in their shoes, and so I have for that reason alone.
And I think it's very important to say it must be very difficult at this particular time because, of course, the days are 19 hours long. So Ramadan Mubarak to all those who follow the Muslim faith. Now, I'd like to talk to you next about an issue that I'm very eager to raise awareness of, and that's the issue of mental health. Over the last 10 years, we've seen some thousands of mental health beds closed across the country, and yet we have some of the highest incidences of mental health illness since records began. Now, I must stress to our listeners that you are not the provider for mental health services in this area. That accolade goes to Lancashire Care Foundation Trust. But you do have a mental health unit on your Blackburn site, and indeed one on your Burnley site too. Now, with more mentally ill patients unable to get access to beds and services, aren't we creating the perfect storm?
This is a very difficult position. So if you go into our A&E or urgent care centres, any one point in time, there will be a number of patients who have got both physical and mental illness within our A&E department, and that causes pressure for them. It causes pressure on staff, and there are occasions when it's not an appropriate setting to treat somebody with a mental health illness. So we work very, very closely with colleagues from Lancashire Care Foundation Trust. They have been under particular pressure during the last few months, from March, April onwards. The pressures seem to be easing a little bit at this point in time, and we're now working, now we've got a bit more room, a bit more headroom. We're working very, very closely with colleagues from Lancashire Care Foundation Trust to think about what facilities, mental health and physical health facilities, should be on this site and the Burnley site to support patients and to support our communities. I wish I had an easy answer to this, Russ, but we are seeing pressures, and those pressures did increase during the winter. What we've got to do is try and put things in place so we can cope with next winter, which will be on us in a few months.
Yeah, of course, you just touched upon the fact, of course, that these patients are unfortunately having to come to your accident and emergency department, which, of course, is under pressure currently from other sources. You don't have the answer. I don't think anybody does. I think the answer has to be to treat mental health patients. There has to be that parity of esteem between mental health and physical health.
Yes, no, absolutely, and we recognise that, and we absolutely support, as I say, support colleagues in Lancashire Care Foundation Trust. I think that parity of esteem and that parity of funding is really, really important. I would say that we do work together. We work as a system. We try and do things together to support patients who have mental health issues, and and quite often we will get patients who have both physical and mental health needs, so they'll need support from both organisations.
Listen, we've got some great news. ELHT, or East Lancashire Hospitals Trust, is now completely a smoke-free zone. The number of patients and visitors, in fact, who contact me to raise concerns about patients and their visitors smoking in doorways and entrances has gone down significantly. Kevin, how have you achieved that?
A great deal of hard work. So there is, again, this is one of those things where you can never say you've cracked it. You've got to keep trying day in, day out. We are very clear this is a no smoking site. Our sites are no smoking, and therefore both staff and patients shouldn't be smoking on site. What we now do is to challenge in a very positive way anybody that we do see smoking and offer them support and offer them help. And what I would say to anybody is to respect that this is a no smoking site. At some point, if you are smoking on site, you will get challenged, you will be asked to support us and stop smoking, and we just have to continue that day in, day out. I think you're right, Russ, the numbers have gone down significantly, but still, every day I can go around the site and I will see people smoking, and clearly that's inappropriate for a hospital facility.
But well done for the initiative, and thank you from those patients of Pennine, Lancashire. Now, I had another interesting comment in that says, the art of being a good CEO or manager involves being very hands-on and visible to staff. Can you tell us how often you actually go onto the wards, and how do you ensure that you really have your finger on the pulse of what's happening in the trust?
So again, I just try very hard. I would never say that we've cracked this one. I try and walk out through wards or departments or on the corridors every day. Sometimes that's official visits to wards and departments. Sometimes that's literally just walking up and down the corridors, just saying hello to staff, looking at the temperature in the organisation and feeling what's going on. I think visibility is important. It's becoming more and more difficult because so much of my work, it gets... Because there's a lot of work to do across Pennine, Lancashire and across the Lancashire and nationally, you can get dragged away. But where I get my energy from, and the bit I most enjoy, is actually talking to staff and patients, to go onto the wards, into the departments and see what's going on. And every time you do that, you can't help but be humbled by the great care that takes place. And so if I ever lost that, I think I would be losing a massive part of the job. So I try hard. Can I do more? I'm sure I could.
But it will be fair to say that you have a whole team under you, an executive team, Director of Nursing, for instance, Chris Pearson, who presumably does ward rounds and things like that too.
Yes, we all do. So we have lots of ways that we do it. So we have something called Back to the Floor, where each one of us every so often will go and work in a different department to understand what's going on. We do patient safety walk-arounds. We do Employee of the Month awards. We do Star Awards. We have lots of different ways of engaging, but I actually find the best way is simply, if I've got half an hour to spare between meetings, I'll take my jacket off, roll my sleeves up, and just go walk around the wards and corridors. And that way, on those informal bases, you find out far more about what's going on.
You had a groundbreaking ceremony at your Burnley Hospital site last week. Could you tell us what's going to be built there and how long it will be before patients can use the services, when those services will be open?
Over the last few years, we've invested significantly in capital facilities, both on the Blackburn site and the Burnley site. And if you take the Burnley site alone, we put a new paediatric outpatient service in, we put new chemo services in, we put a new elective centre, we've got the Women's and Children's Centre, we've got the Urgent Care Centre, and it's all part of our investment on the site. And the next phase of that development is a £16 million phase that's going to upgrade operating theatres, ophthalmic services, outpatients and maxillofacial services. So it's a really significant investment, and if anybody goes on the site now, you'll see that a lot of the old buildings have now been demolished and the new buildings are starting to emerge, and scaffolding and they're starting to be built. I think it's a great investment. It's a great it's just really great that we can invest, even in these difficult times of limited capital, we can invest significant financial sums in the future. So this is a £16 million investment, and we've got ambitious plans after this to continue the investment in the Burnley site. So the next thing I want to do is to invest in new accommodation for staff and to attract doctors and nurses to work on the site. So on the Casterton Road end, there's a lot of old accommodation. Some of that's going to go down, and we're going to put new accommodation there. So all part of the future for the Burnley site. A great example of NHS investment.
I was going to say, because the people of Burnley who perhaps haven't visited the hospital site over the last 2 years maybe will not be party to the fact that you have spent a significant amount of money there, and the site has transformed.
Oh, it is. Over the last few years, we've spent over £50 million transforming the site, and as I say, there's more to come. The Burnley site's really important for us. If you think about the services that undertake there, all our women's and children's services take place from that site. Massive diagnostic capacity, outpatient capacity, maxillofacial services, ophthalmic services, a really important urgent care centre. So significant investment and significant services are used and delivered from the Burnley site. And as I said, we're also working very closely now with UCLAN to improve medical education facilities on the Burnley site, because a lot of our students, our doctors, our nurses for the future will be trained on the Burnley site.
Latest figures available in East Lancashire tell us that there's been a rise in the number of attacks on NHS staff. Now, this is, of course, absolutely appalling and unacceptable on any level, but could you tell us how you support your staff, how the Trust supports the staff to ensure that they're not at risk, and what are your views on the announcement that the Royal College of Nursing was actually supporting the use of body cams to be worn by nursing staff?
Well, this is really an unfortunate trend that's developing in terms of assaults on NHS staff, and whether it's paramedics on ambulances, whether it's staff in A&E, whether it's staff on wards, we are seeing an increase in assaults, and we saw nearly a 20% increase in assaults over the last couple of years. So it is a trend, and it's something that is very, very worrying. I mean, we work very closely with staff, with the staff side, with unions, with different care groups to provide whatever support we can. So we put training in, we provide physiotherapy support, we provide emotional support and backup. And we make it very, very clear to all patients and relatives that we have an absolute zero tolerance to any form of violence against staff on any of our sites.
And presumably that would include verbal assaults too.
Verbal or physical assault. It's just not acceptable. And more we're seeing people using social media as well, and that again is totally inappropriate. So we do try and support staff as best we can. As I said, there's lots of measures that are put in place, but I think we just have to keep saying any form of abuse, be it physical, be it verbal, be it written, is simply not acceptable.
And I think as chair of the Patient Voice Group, I absolutely uphold and back everything that you just said. And anyone that has the audacity to attack anyone who is working as a public servant deserves a custodial sentence and is quite frankly a moron. But that's much my view. Now then, hospital passports designed to help people with learning disabilities are being ignored by doctors, or so the press tells us. The passports assist those with learning disabilities to provide staff with important information about them and their health when they're admitted to hospital. But we've had a report in from Health Watch Lancashire, which has found that doctors are disregarding these passports. And I have to say, this was the first I'd heard of it, Kevin.
So this is, again, I think a really important initiative for us. What we were finding with, particularly with patients with learning difficulties, is that some of our staff needed more support in terms of how to support patients with learning disabilities. So the passport gives real detail about the issues, the health issues that these patients may have, so that when they come into hospital, it's easily understood by our staff and they can provide the best support possible. I would be really concerned if our doctors and nurses were ignoring this advice and this information, and we keep reiterating it and keep re-emphasising it through all that we do in the work and the training with staff. So it is important, and it's important that we follow this advice.
Presumably this passport is something like akin to the butterfly scheme for dementia people, so it's giving clinicians information about that individual.
It is, and it's giving staff the confidence in terms of how they can work with these patients and their families to provide the best possible care.
Finally, Kevin, every month I give you the opportunity, here it is, like he's smiling everyone, to share your reasons to be cheerful. Now these reasons, of course, might be personal or professional. It was football last month as well. But it is an opportunity for you to tell us the reasons to be cheerful. So Kev, what are your reasons this month to be cheerful?
Well, given the weather that we've got outside, I have to say this wonderful weather, and I think it just makes everybody feel that much better, doesn't it? Issues, sort of physical health issues, mental health issues. I think the weather just helps to improve people, and it's fair to say the NHS has had a really, really busy winter. Difficult winter. Staff have been under the most enormous pressure and stress. So I think to get some decent weather, people are a bit happier, things are looking up, and hopefully we can get a few months where we can really focus on developing our services and really putting in place all the good stuff that we're going to need for next winter.
Thanks, Kevin. That's it for this month. Kevin McGee, Chief Executive at East Lancashire Hospitals Trust, on behalf of the patients of Pennine, Lancashire, thanks for taking the time to answer the questions.
Thank you, Russ, and thanks your viewers for the questions again. As ever, the brilliant questions.
Now then, if you'd like to ask a question of Mr. McGee, please do contact us at the address at the end of the presentation. Remember, of course, we are unable to enter into a dialogue about individual complaints, but if you do have an issue that might affect many patients, then please get in touch. I'm Russ McLean, Chair of the Patient Voices Group, and wherever your journey of life might take you, have a safe trip.